Welcome everybody to the September Orthopedic Minute. Today, myself, Bob Keel, and Dr. Jonassen are going to talk about post-operative care after total knee replacement. And so after the total knee replacement is done and you go home, there are a couple things that are kind of important to consider, and we'd like to touch on two of those things. There's a lot more that goes on with recovery from a total knee, but in the interest of time, we'll talk about physical therapy and the care of the post-operative wound. So I'm going to go ahead and describe what the purpose of the role of physical therapy is in post-operative care of total knee. So I've heard several different orthopedic surgeons discuss that you can have the most perfect placement of hardware in a total knee replacement, but if there is no physical therapy afterwards, the recovery and the outcomes can still be fairly poor. And so the importance of doing a good physical therapy regimen is very important for the overall success and satisfaction after a knee replacement. The physical therapist typically will try and schedule 2 to 3 physical therapy visits a week where they help with range of motion, where you can flex and extend your knee, as well as strengthening in the muscles that support the knee. And this is oftentimes can be a very long and lengthy process, can be a little bit tender and painful at first, but the more diligent somebody is with physical therapy post-operatively, the better they do. And so we wanted to discuss the importance of that aspect of post-operative care.
That's right. So, as Dr. Jonassen, I have been doing a knee and hip replacement for many years. With the knee, particularly, scarring after the surgery, which limits the knee motion by causing stiffness, is one of the major things we want to prevent following a knee replacement. So as Bob was saying, the importance of physical therapy and having a home exercise program where you're exercising daily will give the best results. And early motion of the knee has been shown to be important with overall recovery. So after the incision has been closed on the knee, what goes on is like any other wound, whether it's traumatic or surgical, the body starts to heal the tissues, and as it heals with scar tissue. Scar tissue is not as smooth and stretchy and as pliable as normal tissue. So it's very important that as your knee is healing, the movement of your knee joint continues to increase to a normal range before the scar tissue becomes too stiff in terms of movement. So the physical therapy is the most helpful way of helping patients restore the motion of their knee. And the ability to move your knee painlessly and through a full range of motion is the goal of the surgery. So it actually is a very important augment to the treatment of arthritis of the knee with the knee replacement. The incision itself that you see outwardly from the surgery heals in 2 to 2.5 weeks. The important thing to happen as the wound is healing and the incision is healing is that the incision heal without any signs of infection and that it heals together properly. And we've been able to develop a way to cover the wound to prevent any contamination occurring after surgery that might result in increased redness and possibly superficial or deep infection. So the program that we use is to keep the wound covered and allow people to have showers and move their knee in physical therapy to restore motion without the incision being compromised.
Thank you for watching this month's installment of the Orthopedic Minute.